Hi, I'm Dr. Rudra Mohan. I'm your friendly neighborhood dentist, and through the oral health channel, we're going to be talking about gingivectomy today. Let's start. So I come across a lot of gingivectomy cases in my practice, and I wanted to actually sensitize the audience of what gingivectomy means. So if we break down the word gingivectomy, that means gingiv plus ectomy. So gingiv means gingiva, that is the gums, and ectomy means the surgical removal. So you must be wondering, why do we need to surgically remove a part of the gums? Let me tell you something very honestly, that the gums are one of the most proliferative organs in the oral cavity, and they are very good at regeneration. However, sometimes this regeneration can cause a lot of other problems, such as pseudo pockets. By pseudo pockets I mean, in the episode of the pocket which I've actually mentioned, that the gums become deeper from the inside because of periodontal disease. However, a pseudo pocket or a suprabony pocket is such where the gum swells up to such a size that it creates the illusion that we have a pocket. That means the gum has gone deeper. Now this can cause a lot of further problems, because it can cause food accumulation and other infections such as periodontal infections. At the same time, what we have to understand is that when we are doing restorative dentistry, that means when we are trying to place caps and margins, right, of the restorations on the teeth, sometimes we don't have enough structure of the tooth left so that we can have an adequate coping so that the tooth or the cap can withstand the test of time. In such a case, we go for the surgical correction of gums, that is known as gingivectomy, wherein we remove a part of the free gingival margin. By free gingival margin I mean the gingiva, that is, or the gums that are attached to the tooth but are slightly loose and can be manipulated. We cut a part of that so that the amount of length of the tooth or the substructure of the tooth for the cap to be placed on is achieved. So this is one of the reasons why we do gingivectomy, and one of the most common causes why we do gingivectomy. As I've already told, for any sort of pseudo pockets or suprabony pockets where it can cause problems. Now you would want to ask me, where do you get suprabony pockets? Patients who are undergoing orthodontic therapy, because of the food accumulation, they generally tend to have gingival inflammation that might be a little too overt. You might not have bone loss there until unless it's not too severe, but at the same time it can create the illusion of a pocket because of the overt growth of the gums in that area, and that's why, to remove that and make that area more cleansable by the patient, we make sure that the gingivectomy is done. Also, a lot of patients, they complain of a gummy smile. So when they are smiling, right, their front teeth corridor shows and they feel that their gums are too big, or the display is too big, or the gingival display becomes too gummy. Now there are a lot of parameters when we talk about this, because it depends on the kind of size of your upper jawbone and the size of the teeth and their relation. But at the same time, gingivectomy is definitely a part of the aesthetic crown lengthening, where we make sure that we contour the gingival margins so that it becomes a more harmonious display of your teeth while you smile, thereby enhancing the quality of your life. Also, in cases of gingival overgrowth such as pregnancy tumors and all those other things, we do require gingivectomy, and it helps in making the area more cleansable. Now you must be asking, is it painful? No, it's not, because we generally do it under local anesthesia, and there are 3-4 ways by which we can do gingivectomy. The first one and the most conventional one is using the scalpel, where we anesthetize the area and mark the area with bleeding points, and we know that these are the areas where we need to make sure that this is the amount of free gingival margin that we need to remove. We also seldom place a periodontal dressing after that if the area is bleeding too much for whatever reasons. However, with the advancement of technology, we've come across other methods such as electrocautery, which uses heat to cut and ablate the tissue, thereby creating that whole sense of coagulation. That means the blood that comes out because of the bleeding that happens because of the injury, it gets coagulated in the process. However, in my practice, I generally use a dental laser, a soft tissue laser, that also works on the same principle about heat and stimulation of the gums, and we use the laser. The best thing about the laser is that the amount of anesthesia that is required is very less. At the same time, the post-operative discomfort is much lesser than the electrosurgery and the conventional scalpel. That is just my opinion. Journals and literary data might differ, but I have noticed is that the patients are most comfortable around the laser gingivectomy or the laser removal of gums. Now, for you as a patient to decide when do you want to get the gums removed, that's not your prerogative. That's not something that you can decide. But at the same time, when we are going through your treatment, and if you feel that you have a gummy smile, please do visit a dentist and peruse through whatever the treatment options are. At the same time, if you are getting some restorative work done, there's a high likely chance that in the back teeth especially, where the tooth is destroyed due to the decay too much, you might be feeling that there is a need for removal of the gums or the surgical correction of gums, and the dentist will do so. So this was today's episode. Please like, share and subscribe, and do press the bell icon for important updates. If you want to get in touch with me, here are my social media handles. Although I would like to gently remind you that I might not pick your call directly. It's better to leave me a WhatsApp message or a communication on DM via Instagram or other social media handles, because I might be busy otherwise or with the patient. So thanks for listening. Thank you.